You wanted the best? You've got the best podcast. The hottest podcast in the world. The Chris Voss Show, the preeminent podcast with guests so smart you may experience serious brain bleed. The CEOs, authors, thought leaders, visionaries, and motivators. Get ready. Strap yourself in. Keep your hands, arms, and legs inside the vehicle at all times, because you're about to go on a monster education roller coaster with your brain. Now, here's your host, Chris Voss.
Hi, those of us here from the ChrisVossShow.com. There you go, ladies and gentlemen. Welcome to the big show. That voice of mine's getting kind of high there, man. I might want to back off the Michael Jackson rubber bands. Anyway, guys, welcome to the big show. As always, for 16 years, 24 episodes, we've been bringing the Chris Voss Show, and you've been listening to it. So there you go. But share it with your friends and families and relatives. It's a deep secret that we have. The show is even better if you share it with friends. Or enemies. I mean, I don't care who you share with. Just get them to subscribe. Go to goodreads.com for just Chris Voss, LinkedIn.com for just Chris Voss, Chris Voss 1 on the TikTokity, and all those good places on the internet. The stuff I make up in the rambles amazes me sometimes that it's actually funny. We have an amazing young man on the show. He is the author of the new book called The Marpy Advantage. Did I get it?
Nailed it. Yeah.
There you go. The Marpy Advantage. Your essential fact. Wait.
FAQ. Yep.
I kind of pulled a fact. Did you hear the 10T come in there?
As you know, acronym, FAQ, fact,
no, just
frequently
edit.
asked question. You know, it sort of fits in the ballpark, I guess.
I want to get it right here. So we'll edit that out. So he's the author of the latest book called The Marpy Advantage, Your Essential Fact Guide to Skeletal Expansion, Airway Health, and Increasing Your Clinical Value by Dr. Jeremy Manuele. And we're going to talk to him about some of the interesting things, maybe about how you can sleep better, live better, do better, and he'll change your life and you'll be 6 inches taller. I don't know what that means. I just making up stuff at this point. That's not going to happen. The attorney said, scratch that. Dr. Manuele is the Vegas orthodoc. You've probably seen him on YouTube. He is not your typical orthodontist. He is a board certified specialist in orthodontics and dentofacial orthopedics. Wow, I just learned a new word, dentofacial. There you go. Watch for the OnlyFans. Dr. Manuele is at the forefront of redefining how we think about breathing, facial development, and their profound connection to health and performance, especially in kids and adults who are silently suffering from airway-related issues. Welcome to the show, Jeremy. How are you?
Doing well. Thanks for having me, Chris. Glad to be here.
There you go. I learned a new word today, dentofacial.
Dentofacial, yeah, kind of where the bones and teeth interact and meet. Yep, that's it.
There you go. That sounds like my skull. So
exactly.
Yeah,
exactly
I'm gonna start messing with people. I'm gonna go to Starbucks, order coffee, and they're gonna be, "What's your name?" Put on the cup there, and I'm gonna be dentofacial.
There you go.
There.
Yeah,
all right.
They'll love it.
Yeah. So Jeremy,
give us how to spell it.
We're gonna share the love. So Jeremy, tell us your .coms. Where do you want people to find you on the interwebs?
Sure. Yeah. Best place to find me is at vegasorthodoc.com. And from there you can get everywhere else. So yeah.
There you go. So do you help install casino machines in people's mouths? Is that how that works, or what?
Just on my spare time, trying to keep my day job, but we'll see.
Yeah. Do you make it so you can go up to their jaw and you can pull like a lever and it comes down and goes ching, 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 and
that's the technique right there. Yeah,
you
explained it perfectly. I guess we can stop there.
You know how those folks get the grill? Like everybody, those rappers get the grill. Yes. You could have a casino grill. It lights up and noise.
There you go. Or you can win a grill at the casino.
Win a grill at the casino. Yeah, that. There you go. Check it make sure you wash it. So anyway, Jeremy, give us a 30,000 overview. What's inside your new book?
Sure. Yeah. So this new book is actually tailored to practicing dentists, orthodontists, and other dental specialists who want to learn more about non-surgical adult palate expansion. So it essentially helps to teach them the techniques behind adult palate expansion, why you would do it, how you incorporate it into your practice, and a lot of the physiology behind the benefits of having your upper jaw expanded in an adult if you're having struggles.
Why does it seem? I'm feeling a little bit of pain when I think about this. Like,
Sure, yeah.
you
Yeah,
know,
no, it's a new concept, right? So, 20 years ago, the only way to change an adult jaw would be through some form of jaw surgery. And that was sort of the way that it was done. And you have a longer recovery, the risks are higher. A lot of times you're in the hospital. So, non-surgical expansion for adults really started to come out about 10 to 15 years ago. It was being developed. But only about 5 years ago did the imaging and the planning ability and also the appliances that we're able to use for that, were
Mhm.
they really refined. And at that point, we were able to predictably get upper jaws in males, females, non-growing patients, adults expanded. The
Mm.
oldest adult that I've expanded is about 71 years old, but
Mhm.
we expand all ages if their upper jaw is small and if it's going to benefit them.
Wow. The and it's the upper jaw. That seems like, I can see how my lower jaw might be easy to be expanded because it's kind of hanging there, but the upper jaw is kind of attached to my skull last time I checked. Kind
Exactly.
of
Yeah, it's a
weak.
fascinating process. Yeah, so the lower jaw is actually one bone. So after birth, it's one bone. So you can't really expand the lower jaw
Oh,
unless you do some form of surgery to cut it and make it two bones. Then you can
wow.
just then you can expand it. But the upper jaw is naturally two bones. And so when you expand the upper jaw, the two halves of the top jaw separate. You get a little
Really?
gap between your front teeth, and everything else that's attached to your skull actually bends. And
Wow.
so as your jaw is widening, all of the other bones in the face are actually bending out. And that's how you get the benefits of the nasal breathing. So the
Mm.
bone that the upper jaw bone itself is actually the floor of the nasal cavity. So
Mm.
as you're expanding the upper jaw, the nasal cavity is widening and air can pass through it more easily.
There you go. Boy, that sounds like one of the worst hangovers I've ever had. I think I've had that pain just overnight.
Definitely an
And in
adjustment getting
Vegas,
used
by the
to
way.
having anything in your mouth, but for
Yeah,
sure. Yeah.
yeah. After a night in Vegas down at the Spirit Rhino, I'm not sure what that means. Anyway, kicking back that wild turkey, JD. Those were the bygone days. So, this is pretty interesting. So, who does this help as a consumer out there? Who are the people that this benefits? Or are you just doing this for fun?
Yeah, mostly for fun, but yeah, there really are subsets of patients that this helps. So there's three reasons that people seek this out. So one is that they can't breathe or they can't sleep. So they can't
Mm,
get air in through their nose, or they're sleeping, they're waking up tired, they're waking up multiple times during the night, they're having
mm.
apnea events. And so that's one subset of patients who will seek out maxillary expansion as an alternative to things like CPAP or jaw surgery,
Oh,
or other things they either don't want or can't tolerate well.
so this
The
can help
next
with the CPAP people that wear the Darth Vader mask at night and shit.
that's correct. It definitely can help.
Oh,
You have to. It's more nuanced than that, right? Not all sleep disorder breathing, not all sleep apnea is the same.
okay.
But certainly, if the sleep apnea is being caused by your inability to breathe through your nose, then it's going to improve and/or sometimes even cure that
Hmm.
via expansion. So that's one subset
Can
is
it
the patients who are.
replace the CPAP maybe in some cases?
In some cases, it can. I would say mild to
Huh.
moderate. A lot of times, it can replace the CPAP completely.
Huh.
But more severe sleep apneas, it's typically going to reduce your reliance on the CPAP and/or allow you to lower your pressures, and/or possibly you can manage it with more like a mandibular appliance or something else that's more comfortable.
A
So there's
mandibular appliance?
yeah. So
Like a stove
basically,
or something in your mouth? What's going on there?
yeah, so the mandibular appliances, what they do is they move the lower jaw forward. And
Uh-huh.
so the lower jaw is attached to the tongue and everything else comes forward with it. So when you bite into the appliance, your lower jaw is
Hmm.
artificially moved forward, and that
Hmm.
can open up your airway and help you sleep. And so a lot of patients who can't or won't tolerate CPAP will do mandibular advancing appliances for that reason.
I think we've had some people on the show that have done that. They make like the mouthpieces and stuff, and they talked about it, but I was kind of like, I don't know. I'm not a real
Yes.
fan of putting stuff in my mouth while I'm sleeping because I'm paranoid I might swallow it.
Yeah, well, obviously you have to make sure that it's fabricated correctly. Have you ever met anybody that swallowed anything while they sleep?
I mean, I don't know. I heard this. I think it's a conspiracy theory, but people eat like 500 spiders, with their mouth open while they're asleep in their lifetime or
Right?
something. I don't know if
Yeah.
it's true,
So
but
besides the spiders, I mean, by and large, people don't swallow things very often when they sleep because the body's natural reflex to spit things out of the mouth.
the gag
Yeah,
reflex.
exactly. Typically
Uh,
happens whether you're awake or not. But you do definitely want to make sure you don't have little pieces flying around in your mouth. I mean, you could aspirate it, things like that. So make sure if you do an appliance, make sure you do go to somebody that knows what they're doing with those. I don't make sleep appliances. Again, we focus more on the underlying cause of the anatomy and the skull. But there are great practitioners out there who do sleep appliances, and you'll want to make sure you go to somebody who knows what they're doing when it comes to those.
I can't get this Home Depot a sleep appliance.
Yeah, you give it a shot. A couple 2x4s, some screws, probably be all right.
Give me a whole mess of content to go screw with people. I can fuck up Starbucks now, and then I can go to Home Depot and go, which aisle is the mandibular appliance on? What is that? I think it's an air conditioner. I don't know. It's air conditioner for your mouth. Some people need that too. So this is kind of a newer technology. That's probably why a lot of people haven't heard from this, just to clarify that, because I wasn't too aware of this stuff when I started hearing about it. Like I said, we have people on the show. I was just like, yeah, that seems kind of, new.
Yeah, it's interesting because I think part of it is the more people become educated about breathing and how that relates to their sleep and their overall health, then they start to seek out solutions for those issues that they may be experiencing. So yes, not very well known in the community at large. It's becoming increasingly more well known within the dental community as more and more practitioners are jumping on board and treating cases and publishing their results. It's now catching wind, especially in orthodontics and general dentistry, a little bit in surgery, oral surgery as well.
I just want to get that top area to separate so I can have that cool space in my teeth, like David Letterman. I'm a big David Letterman fan. Yeah. Plus, you can whistle through it, right?
A little practice. I'm sure you could.
Yeah. Didn't the one gentleman who's a football player, he has a little list too. I think he's on Good Morning America. He has that kind of too. And
there you go.
I think he had that list to work on.
Yeah,
he's a great
celebrity to follow and match, and we can make the gap that size. So
now, if I just master Letterman's beard he wears nowadays, that thing is fucking epic. It's like something from Rumpelstiltskin sleeping. Is that the one? Do I have the right fable? I don't know. So we talked before the show. I've had TMJ all my life. There was a time where it was really bad. Like I could sit and pop it and it'd be noise across the room. And, it had its own zip code and phone number. It seems to have calmed down in my old age, but it's still there. There's a huge lump there. And, it kind of it pops, but I don't mess with it. I leave it alone. It seems to leave me alone for the most part. But, I'm a big guy and I've been told that I snore very loudly and my mom's always like, you need to get Darth Vader mask thing. And she doesn't sleep well and she has it. So no one I've ever met, when you get them to be honest, they tell you they still don't sleep well. It's kind of like people who sell you an MLM. I think that's how I feel about it. I'm not shaming anybody or shitting on it, but it does feel like people are selling me an MLM when they sell it.
When you look at the data on CPAP, typically it's about 50% compliance. So you got
really?
About half of the people out there that will stick with it, and then the other half, just for whatever reason, either it doesn't work on them or they just can't. They can't.
I had a friend who paid all the money to get the CPAP in his chest.
Yeah,
it was like 30 grand or some crap.
Okay.
And he doesn't even use it. It doesn't work for him very well.
Interesting.
And I'm just like, that's in your body now. That's kind of like putting Neuralink in your stuff from some guy who's heavily addicted to ketamine. It's what is it? What day is it? It's 5/30/2025, and the Washington Post is reporting about a severe ketamine addiction of a certain number one billionaire. That's where the joke reference comes from. You'll have to Google it. Anyway, we mentioned, so this can help my TMJ or people that have TMJ. I know people that have surgery for it.
Yeah, so that's kind of the next big subset of patients who seek this out is patients who are seeking functional improvement. So TMJ is one of the functional improvements that you can achieve with this. Also, just getting the teeth to fit together. So some people teeth can't fit together properly because their upper jaw is too small, and their teeth end up hitting on top of each other. They end up breaking them down, needing crowns, root canals, all those types of treatments.
Are those people I've seen where sometimes their teeth are kind of offset? Like you can see that the one, every other tooth is behind the other one a little bit.
Yeah, crowding. Yeah.
Yep.
Yeah. So when the teeth are crowded, they don't fit together either. And if they're crowded because the upper jaw is too small, we can widen it, and that's going to make more space within the upper jaw. It's going to start out between the front teeth, but then we're going to use that space, move the teeth into it So of course you finish without a gap and the teeth straight. But by expanding the upper jaw, you can get the function better. So you can get their teeth to actually fit together the way that they
Wow.
should. And that's the link back to the TMJ disorders. So if the bite is functional and your bite is not forcing your jaw to go into an unnatural position, like many patients who have TMJ disorder, that's what's happening. Their teeth are pushing their jaw into an unnatural and uncomfortable position. And then that causes inflammation in the jaw joints, which translates to pain for many people. And so if we get the teeth to fit together, ideally by starting with making the jaw ideal, then the TMJ is not having all that stress on it that it used to have, and the symptoms can often go away completely.
Wow. Yeah, there's a lot of times where I bite my tongue, man. I've just about bit it off sometimes. And I'm
Yeah.
like, I'm 57 and I haven't learned to fucking chew yet. Like what and maybe that's from that, I guess.
No, it's if your teeth are making your jaw go somewhere unnatural, it can be very, very uncomfortable. So
Yeah.
every time you put them together, it can be, that inflammation starts to happen, then your bite shifts further and it becomes a very painful and sometimes progressive problem.
There you go. And here I just thought I was going the wrong glory holes. Anyway, it's Vegas jokes. I don't know what that means. But you can find it in Eastern and Sunset. Uh oh, the Vegas jokes. So I notice on the thing it talks about um how it can where was it? I saw it. It can improve your smile, I think it was. Did I
Yeah,
say
so
that?
that's the third big reason why people seek this out. So if they feel like one of two things, A, if they feel like their smile is narrow and
Hmm.
they want a more broad smile, then they'll seek out this treatment. And then also, if they feel like they're not showing enough of their teeth, like when they smile, if they're not showing all their teeth or they want to show more of their teeth, then as we expand, the teeth will drop down a little bit. And so it can improve how much of the teeth that you show as well.
Wow. That's really I mean, that's wild. I had no idea. I thought this was pretty locked in up here. And I
Right.
thought if you're gonna do any like I've seen those natives, and you ever seen that where they I think they do something to their lower jaw and it like will hang down and expand. They're in
Hmm.
Africa.
Uh-huh.
And or they do I think they do something with their jaw. Maybe it's the upper jaw, but no, I think it's usually hanging out there. And then you just look at it and you're like, well, you can't close that thing. I mean, that's you must snore like a um one thing you talk about is it normal for children to snore? That seems a little bit odd that they would snore at that young age because they're not overweight yet, or they shouldn't
Yeah,
be.
a lot of parents think that snoring in children is normal, but it's really not, and it's typically a warning sign for that there may be something else going on with
Really?
their sleep. I'm a huge advocate of getting kids tested,
Mm,
doing a sleep test. You can either go to a sleep center and do that, or even just
really?
doing one of the ones that you can do at home. But getting some information if your child is snoring consistently. With snoring, it's indicative of some sort of airway obstruction, whether that's the tongue, the tonsils, the adenoids, something caused by the jaw size itself. There's
Mm,
something that's causing those tissues to vibrate and snore. And when you're a child, the tissues should be nice and firm and healthy. There shouldn't be anything wrong with them. They don't get saggy like they do in adults. So
mm.
if you're snoring as a child, that's only going to get worse as you age if it's not addressed.
Now I know that effects on the brain of lack of oxygen. I've seen people on Twitter, and also just not getting sleep can deregulate. If I don't get my sleep, man, there's murdering that's going to take place. The judge just can't do that
Exactly.
anymore.
And you
Um,
multiply that with the kids, right? I mean, so
yeah.
so a lot of parents whose kids get diagnosed with ADHD actually have sleep disorder breathing.
Wow.
They did a study and they took this group of kids that was diagnosed with ADHD and on stimulants, and they also had large tonsils and adenoids. And so they sent them to get their tonsils and adenoids out, and
Yeah.
then they were retested for the ADHD criteria, and almost half of them didn't meet the criteria anymore.
What?
And yeah, exactly. And as you know, ADHD is a brain thing. It doesn't like just go away. So what happened was they were actually misdiagnosed. They had sleep
Oh.
disorder breathing, but the
Mm.
symptoms are the same. If you look at the symptoms of an ADHD kid, they're very similar to the symptoms of a really tired kid. And so, that's one of the first things that I always like to recommend as well when I have patients come in and they report a history of ADHD or they're on stimulants or other ADHD medications. That's the first thing I'm going to ask them is if they've ever gotten a sleep study
Mm.
to rule out any problems that there may be with the sleep.
Can it help you if you have meth teeth? Get those teeth brought together. I'm just kidding.
Yeah, we got people for that.
Get off the meth first, folks. There you go. So what else do we need to know about this technology? I guess it's fairly safe and FDA recommended. Is that the people who give our site?
Yeah, so basically, yeah, a palate expansion in general, the younger you are, the easier it is to do. So when, we'll expand, sometimes kids as young as 4 or 5, if they're having documented sleep problems. Most patients, if they need expansion and we see them early enough, we'll expand them around the age of 7. And you can use traditional type expanders all the way up till the child's 12, 13, 14, maybe even 15. But the older you get, the less well these expanders work in moving the bones. So as you continue to grow and your bones are firming up, it gets more and more difficult to actually separate the bones when you expand. So you might put a normal expander in a 16-year-old, let's say, and you might turn that expander and you might see the teeth move out, but it's going to be very difficult to get the actual bones, the 2 bones to move apart, get the gap between the teeth, and actually get the upper jaw wider.
Wow.
So starting in the teenage years and then going all the way into adulthood, that's when we start to add what are called temporary mini implants or micro implants into the jaw to support the expansion. So in addition to the expander connecting to the teeth, there are mini implants, and depending on how old you are and what your bone looks like, depends on how many of those you need. That anchors the expander to the jaw itself, which allows for us to predictably open and widen that jaw.
There you go. There you go. Now, what does this thing look like? I can see something on the cover of the book that looks like it's inside the mouth.
That's exactly what it looks like.
Okay. So for people that are listening, because most people consume it through the thing, what is this sort of contraption you've got in your mouth? Do you you only use it when you sleep, or you walk around with your day like braces or something, or what's going on there?
Yeah, so the expander is fixed in your mouth typically for about 6 to 9 months, depending on how much inside the mouth. Yes, for about 6 to 9 months, depending on how much expansion is needed. Wow. So there's a portion of it with most of these expanders that connects to the teeth, and then there's a portion of it that connects to the bone via little temporary mini implants. Wow. And so those implants are placed at the same time the expander is placed. Of course, you're numb for that procedure. It's an in-office procedure. You're not sedated, or there's no like general anesthesia.
What if you really want gas, though? That good gas.
You'd have to go to somebody else to get those placed. Then, yeah. So if you had like super high anxiety and you wanted the gas, or you wanted if you wanted to be sedated for it, there are practitioners that can place the implants under anesthesia. But I don't do that. It's
I'm just coming for the gas.
Yeah, just the gas. Yes, yeah. I think you can buy it online now.
There you go. So, and you said 6 months you might have to wear it.
6 to 9 months. Yeah. So there's an adjustment period in the beginning. Most adults are not used to having anything in their mouth full time, and so when you have the expander, sometimes it's a little bit different learning how to speak again with it. Swallowing, you have to learn all these patterns over again. Typically, about the first week or so is when patients will go through that adjustment period and relearn those things.
I'm gonna have to go on your website and see what this looks like in the mouth, because it looks. It looks like from the cover of the book, it's in there and kind of springy, stretchy, loaded, and it looks like one of those I don't know, compression outward things, and it looks like big enough to where it might be hard to eat or something. I'm not sure I want my girlfriend to have this.
Yeah, it's an adjustment, right? So like chewing the food, moving it all around, all those things you have to adjust to for sure.
Really?
If you Google custom MARPE, so custom MARPE, you can get some visuals of what it looks like in the mouth, and then there are some on my website as well. If you scroll
I got an OnlyFans up. No.
Let's see. You might. I don't know.
Oh wow! Holy crap! Whoa, that's a piece of steel there.
It is 3D printed. Yeah.
Wow, holy moly. Wow. It looks like alien took over the inside of someone's mouth. And
exactly.
Put one of those implants in there. Wow. There you go. But I guess, hey, man, if it works, then it works. Does insurance cover this sort of thing? How does that work?
Yeah. So typically with orthodontic insurance, there's a limited benefit to what you have at, $1,000, $2,000, $3,000. So whatever your benefit is, you'll get it, toward your treatment overall. So it helps.
There you go. I might have nightmares of what I just saw in the freaking. Because
Yeah.
as to people, they got their mouth like, why? I mean,
All right. So you got to search another term now since you're Googling. So search jaw surgery. Yeah. Search jaw surgery.
Now, is this going to be? I'm one of those bad blood guys. If I see blood, I start passing out.
All right. Well, maybe don't then. But yeah, when you compare what that looks like to jaw surgery, it becomes a lot easier to digest in stomach.
I'll just imagine my first 10 divorces, and I think that's painful enough as it is as a reference point. So there you go. So let's talk about what else. And no, so this book is targeted towards other orthopedic
other
people in the
orthodontists,
business
other
to
general
kind of
dentists,
get
surgeons.
up to speed on the technology, as it were.
Correct. Yeah. So again, it's still relatively unknown and less well known in the dental industry because there's not a lot of people out there who have sought out the training to do that. They're not training for these things in residency or in the dental training. So you're not getting any education on it. So if you want to learn about it, you have to basically attend additional training. So one of the things that I have is an online course for dentists. It's about 8 hours long. And it goes through the physiology behind it. How wide do you want the jaw? How do you measure it on the x-rays? And then it goes through the appliance design. How do you design the appliance to achieve that? It also goes through the airway physiology. So why does it improve the airway? How can you know by looking at the imaging and asking the right questions if it is going to improve your airway and sleep? So all of that's covered in the course. And the book is a supplement that helps. It basically allows you to understand some of the things that are in the course at a more rudimentary level.
Yeah. Well, it's interesting, and I suppose it can add some revenue stream to the thing. I think the book implies, and so it can give people thing. But the more options you can have, like I said, that's everyone always tries to, like an MLM, get me to join the Darth Vader mask sleeping group. And I'm just not sold on it. I've met too many people. First they start talking to you, and you're like, hey, so this is an MLM, right? And they're like, no, you'll be able to sleep like a baby. I sleep good all the time. And then you start hanging out with them, and they're like, oh man, I didn't get sleep last night. I'm like, I thought you had the Darth Vader mask. And they're like, I don't have 5 people in my downline. You're like, I see what's going on here.
So, have you ever had a sleep study? Have you ever actually gone in and done it?
No. Yeah. I sleep like shit. I don't have to study it. Hey, you know how to sleep good in my world? Edibles.
Oh, there you go. Or if you don't, you'll forget about it or not care. One of the two, right?
Yeah, I can't feel my legs. But no, you do if you want to sleep good. Edibles are good, but you know what? Sometimes after years, they don't work as good. You got to take like 500 of them or something. I don't know. Anyway, don't do that, folks. This is a joke. There you go. Texas has a war on THC too now. I just saw that going. So, what else do we need to know about this, or do we want to talk maybe about some of the offerings that you have at your clinic there in Las Vegas?
Yeah, for sure. Yeah, no, that pretty much sums it up. I mean, airway function and aesthetics are kind of the 3 things that people look for with expansion. There's a lot of other information on the website you can get, vegasorthodoc.com. I am in the process of writing a more patient-focused book so that patients can read it. So hopefully by the end of this year, the beginning of next year, we'll have that out.
I see where you there. You got the patient book, and then the patient will read the book, and then go bugger their orthopedic doctor, and then their doctor, and then they'll be like, "Hey, you got to buy the other book for you."
Yeah, you'd be surprised at how many patients that we see that do that. They'll go and they'll try to find a local provider to do that for them. So one of the things we haven't talked about yet is, again, this is a fairly niche topic. So one of the things that I do is online consultations for patients seeking out this treatment specifically. And it's not necessarily for me to treat them. It's for them to have a good understanding on if they're actually a good candidate for this. And why or why not, and what are the expected changes that would happen? What are the considerations with designing the appliance? So on vegasorthodoc.com, you can go to the Get Consultation, fill in some information about what your situation is, what your struggles are, what you're looking to achieve with expansion. And then you'll send in all of your imaging, which you can obtain locally. And once we have the imaging, we'll go through and we'll dissect it and let you know, like, are you a good candidate? Yes or no? Why or why not? What does the anatomy look like? What do the bones look like? What does the nasal passageways look like? Are there constrictions? Are the tonsils and adenoids enlarged? All those things. So we'll go through that in detail and send you a video consultation about your case specifically, so that you can know, if you're a good candidate or not. And if you are a good candidate, what are the things that you need to consider? How's it going to affect your smile? How's it going to affect your face? Like, what are things going to look like afterwards? All of these are questions that people have that are answered via those consultations. So we've done them for people in Switzerland, in Japan, in Mexico, in Canada, all over the world, who are learning about this procedure and then seeking out information about it.
Wow. Yeah, I mean, sleep's a real important thing. It gets harder as you get older. What about people who have asthma? Will it help with people who have asthma and
Yeah.
stuff like that?
So, asthma is very, very interesting. And so one of the root causes of asthma is what they call overbreathing. And so here's a fun fact. Do you know how many people died of asthma before we had asthma medications?
How many?
0. So what happens is, and it's not funny, but what happens is when patients start, patients start taking asthma medication, and it helps their symptoms, but it also makes them become more reliant on that medication. So if they don't have it and they have an asthmatic crisis, they can asphyxiate and essentially die. Thankfully, that's common even today. But with asthma, one of the root causes is actually overbreathing. And what I mean by overbreathing, most commonly it's associated with mouth breathing. And so these patients are exhaling their carbon dioxide at a higher rate than is normal. And if you exhale too much of it, it can trigger spasms due to the physiology that takes place when the carbon dioxide is lost that way. And so that's why one of the things that you may have always heard is that, if you have asthma, become a swimmer. And swimming is good for kids who have asthma. The reason for that is not that they're breathing out of their mouth when they swim. It's that they're not breathing as much when they swim. And so with asthma specifically, if a child can't breathe through their nose, they're going to have to breathe through their mouth. And so if we expand them and allow them to breathe through their nose better, well, if they're nasal breathing, they are not going to be releasing the carbon dioxide at that higher level and overbreathing, which is going to reduce their asthmatic symptoms.
There you go. Wow, man, I learned a lot today. I know some people on Twitter that are over breathing, and they should just stop permanently. No, I'm just kidding. Maybe less, but I don't know. They actually probably need more oxygen, because clearly they haven't had enough oxygen in some of the ways they think. So there you go. What else do we need to talk about that you offer at your service there? This is something people have to come in for, right? I can't just order this off Amazon.
That's correct. Yeah. And additionally, like, depending on, where they live, they'll have to find a provider that is, that knows how to do this. Right. So most orthodontists and dentists today either don't know about this or don't know how to do it. And so you'll want to find somebody that has experience in expanding wherever you live. We do treat some patients from out of town or different places, but it really just depends on the complexity of the case and what you need orthodontically and whatnot. But I would say a lot of patients that we see for consultations online, we don't end up treating, just because they would be better treated by a local orthodontist in their area.
Well, here's an idea. You need to offer packages. So if you're in Vegas, I fly in, I stay at the Bellagio, and then I have, I don't know, VIP at Spirit Rhino, and then somewhere in there I get the surgery done, and I just bill my insurance for all of it.
There you go. Just loop it together.
Illegal? Illegal? Head out to I can't remember the city outside of Vegas, but never mind. But yeah, you can just write it off. Write off all those. You come in, you get a little blackjack, spend the kids' college fund, and then you then you get your teeth fixed. So at least you got that going for you.
Exactly. There you go.
I can see this. This is why they pay me $5 a day for this.
Yeah, you got all the good ideas.
The good ideas.
So other things that we do that are more unique. So one of the things that patients often know about but don't know what to do about is how much teeth they show when they smile. So you have some patients that show all of their teeth and some of their gums, and sometimes even a lot of their gums. And they call that like a gummy smile. And so other patients, like when they smile, they only show their bottom teeth, or they don't really show much of their top teeth at all. So those are kind of the two ends of the spectrum. And depending on what you want your smile to look like, that can be adjusted orthodontically. So it used to be that in order to adjust that, you would have to have some form of surgery where they would actually break the upper jaw and move the whole thing either up higher or down lower. But now what we do is we use those same temporary mini implants that we use on the expanders. We place them other places, and we use those to anchor and actually either move all of the teeth up toward those pins or push them down away from the pins and change the amount of teeth that you show when you smile.
Wow. You know, I've seen some beautiful women that they'll have a smile, and they're beautiful women, but you'll see that gummy thing there, and
Yes.
it can vary, but it's a you're just like, maybe you shouldn't smile so large there, but that's great that can be repaired.
Absolutely.
Yeah, that's awesome, man. I mean, I might start expanding my dating pool. Maybe
And
a
there you
little
go.
bit there. Yeah.
There's a piece for that.
Can the organ expansion work on other parts of the body? Asking for a friend. I'm not sure you want to put that much steel down there. There you go. There you go. So as we go out, give people your final pitch out. How can they reach out to you? How can they learn to know more? And of course, where to pick up the book.
One of the things that I enjoy doing is providing a good evidence-based education. So if you go onto YouTube and you search Vegas Ortho Doc, there are a number of videos that we post on all of the types of procedures that we're talking about today, but also a lot more about the science behind those procedures and why they are effective. And you can actually see on the imaging those things that we were talking about and discussing today. Additionally, there are actually full-length lectures. I do teaching at the dental school. And so you can find like full-length videos as far as going through cases, diagnosing and treatment planning these cases. So, if you're curious about it, I mean, obviously a lot of doctors watch those videos, but we have a number of patients who really get into this and they want to see all the videos as well. So those are all there on Vegas Ortho Doc on YouTube. And then VegasOrthodoc.com has the links for everything else that we have going on, specifically the online consultations. Any books that we drop will go there first, and anything else related to expansion you can find on that website.
There you go. Well, I've learned a lot today, and seen some pictures that will give me nightmares. So there you go. But yeah, it's I mean, that's I don't know what to say about the whole thing, but thank you very much for coming to the show. We really appreciate it, Jeremy.
Of course. Thanks for having me, Chris.
There you go. Thank you, and thanks so much for tuning in. Order the book wherever fine books are sold. It's called The Marpy Advantage, your essential fact guide to skeletal expansion, airway health, and increasing your clinical value. I just want to go to fact on that with a T.
FAQ. Frequently asked questions.
Fact, FAQ. I don't know what's going on. It's Friday. Anyway, thanks so much for tuning in. Go to goodreads.com/Chris Voss, LinkedIn.com/Chris Voss, Chris Voss 1 on the TikTok and all those crazy places on the internet. Thanks for tuning in. Be good to each other. Stay safe. We'll see you next